For many new parents, breastfeeding is expected to feel natural, so it can be frustrating when feeding is painful or the baby seems unable to latch well. One possible reason is a tongue tie or lip tie. On Pump with Sabella, we want you to know that these conditions are common, they are often manageable, and they do not mean you have failed at breastfeeding. A tongue tie happens when the thin piece of tissue under the baby's tongue, called the frenulum, is unusually tight or short. This can limit how freely the tongue moves. A lip tie involves the tissue connecting the upper lip to the gums and may make it harder for the lip to flange outward during feeding. Because breastfeeding relies on a baby lifting and extending the tongue to draw milk effectively, restricted tongue movement can affect milk transfer. Babies with a tongue tie may struggle to maintain a deep latch, make clicking sounds while nursing, slip off the breast, feed for very long periods, seem constantly hungry, or have poor weight gain. Parents may notice significant nipple pain, pinching, cracking, or misshapen nipples after feeds. It is important to remember that not every visible frenulum causes a feeding problem. Many babies have prominent frenulums and breastfeed normally. A diagnosis should be based on both the appearance of the tissue and the baby's feeding function. A lip tie alone is less clearly linked to breastfeeding problems, but some babies with a tight upper lip have difficulty achieving a comfortable seal. Signs can overlap with tongue tie, so a full feeding assessment is helpful. If you suspect a tongue tie or lip tie, seek evaluation from a pediatrician, lactation consultant, pediatric dentist, or ENT experienced in infant feeding. They will observe a feeding, assess tongue movement, check weight gain, and look for other causes of breastfeeding difficulty. Treatment is not always necessary. Many families improve with skilled lactation support, better positioning, and latch adjustments. When a significant tongue restriction is clearly affecting feeding, a simple procedure called a frenotomy may be recommended. This involves releasing the tight frenulum and is usually very quick in young infants. Some babies feed better immediately, while others need time and continued breastfeeding support. After a release, continue offering the breast frequently, practice deep latch techniques, monitor diapers and weight gain, and stay in touch with your lactation consultant. Healing and feeding improvement can take days to weeks. Please contact your baby's healthcare provider promptly if your baby is not gaining weight, has fewer wet diapers than expected, seems lethargic, or if your nipple pain is severe enough that you are considering stopping breastfeeding. The most important message is that persistent breastfeeding pain is not something you should simply endure. If feeding hurts or your baby seems unable to transfer milk well, ask for help early. With the right assessment and support, many families go on to have a comfortable and successful breastfeeding journey.